Okay. What about your any funny part? Have you experienced any?
पेशेंट था हमारा और कैटरेक्ट सर्जरी कराए, हमने उनको ड्रॉप्स दिए। वो अगले दिन फॉलोअप के लिए आए और ड्रॉप्स खाली थे और बोला
हाँ.
कि ड्रॉप्स ख़त्म हो गए। तो एक ड्रॉप जनरली 5 ml का रहता है, 20 दिन चलता है। तो एक दिन में ख़त्म कर देना, मुझे लगा हाथ से गिर गए और तीनों के तीनों खाली थे। तो मैंने उसको एक नया पैकेट दिया
नया पैकेट में.
ड्रॉप्स का और बोला कि आई वॉजेंट अवेयर कि कब उसने डाला होगा लास्ट अपनी माँ को ड्रॉप्स। तो बंदा बाहर गया, बैठा और मैंने उसको बोला डाल दीजिएगा। और मैं सीसीटीवी कैमरा कुछ काम कर रहा था, सीसीटीवी कैमरा पे मेरी नज़र गई तो ये बंदा माँ जी का मुंह खोल के मुंह में ड्रॉप्स डाल रहा है 4-4 5-5 बार।
Hello guys, welcome to Fit the Fashion. So, firstly, a warm welcome to Dr. Salman Patel, a
थैंक यू फॉर हैविंग
gentleman, a multiple year of experience, a surgeon. There are multiple things to say, so you can say.
Thank you for having me on your podcast. Yeah, so my name is Dr. Salman Patel.
Yeah.
I'm the director of Vision for All Eye Centers and Eye Foundation. We basically specialize in all forms of eye care. At charitable, we have a charitable wing as well as we have a private wing, and we've got two centers right now, one at Marine Drive, one at Baikalla, and I'm attached to Sefi Hospital too. And I basically look into and specialize in preventable blindness.
Yes.
So my subspecialty is anterior segment surgery. So I'm into refractive surgery and cataract surgeries. So the mainstay of blindness that is preventable in India is refractive errors. That means those people who have glasses and they don't wear glasses, and people having cataracts. These form the chunk of the preventable blindness that if we can restore their vision, they can function and rehabilitate themselves into society as.
So, why you choose this career?
So
What?
why I became an eye surgeon? The thing is that if you want to enjoy anything in life, अगर
Yeah.
आपको ज़िंदगी में कोई भी चीज़ के मज़े लेने हैं, उसके अंदर एक सेंस है आपके सारे सेंसेस से जो उसको एक एक्सपीरियंस बनाता है, जो विजन है.
So, what's the year of experience you're like?
So I finished my fellowship around 5 years ago, and then prior to the fellowship, 3 years of post graduation. You can say around 8 years, and then yeah, around 8 years, 8 to 10 years. You want a specific date? Then I'll have to calculate it. Yeah.
Okay, so first thing, the current affair about, as you can see, the fake is going on. That is, what is red eyes?
So red eyes is basically conjunctivitis. It is the inflammation of the conjunctiva, which provides blood across the sclera, which is the white layer below it. So in conjunctivitis, most of the conjunctivitis that's currently common is a viral conjunctivitis, and the symptoms will be you'll have a foreign body sensation. आपको ऐसे लगेगा आपके आँख के अंदर कुछ है, आँख लाल रहेगी, पानी आएगा आँख में और खुजाती रहेगी आँख. And this is a highly infectious state of infections where it's very
Is
it's
it dangerous?
yes, it can be dangerous in a way that so for most people it would only affect the conjunctiva, but if the viral load and the immunity of the patient is not that great, it can even affect the cornea, and this will be classified as keratoconjunctivitis where the cornea is involved. So this will be marked with intense pain, बहुत ज़्यादा दर्द होगा, आपको धुंधला दिखाई देना चालू होगा, and you should seek immediate specialist opinion on that. But it can be taken care of.
And what about that कि sunglasses?
Sunglasses basically is
बहुत
the
लोग के कहते हैं कि यार देखने से बढ़ता है. What about that?
देखने से बढ़ता है तो एक मिथ है यार, एकदम ऑनेस्टली इट्स अ मिथ. देखने से तो नहीं बढ़ता है, जनरली बढ़ता है टच से. इन्फेक्टेड
Yes, true.
tears that you will wipe your handkerchief, your personal belongings, and other
Belongings,
people
actually.
come into your space and they get the infection and then they rub their eyes and that's how the infection spreads. तो ये चश्मे की क्या बात है? Why they wear black glasses is because लाइट से उनको बहुत तकलीफ होती
Light
है.
से तकलीफ होती
तो
है.
सन ग्लासेस पहनने के बाद उन लोगों को आराम रहता है और दूसरे लोग भी खुश रहते हैं कि इसको आँख आई है, इसने
आँख आई है.
सन ग्लासेस पहना है, तो मुझे कोई भी प्रिकॉशन लेने की
हाँ.
ज़रूरत नहीं है, मैं देखूंगा नहीं तो होगा नहीं. बट अगर if there is going to be a cross contamination with his personal belongings and I rub my eye, 100% I will start developing the symptoms.
So for that, there is any prevention?
Wash your hands. Just keep washing your hands, and don't touch your face.
Okay.
Yeah, don't use a handkerchief. Use a tissue paper, which you can discard immediately after using. And yeah, stop shaking hands. If you're going to stop shaking hands, your chances of getting the infection are the lowest, because most infections spread through a handshake.
Any pre-symptoms?
um, it's just that you're going to wake up one day, you're going to have slight amount of irritation through the buildup of the viral load, and आप सुबह में उठोगे, आपकी आंखें लाल रहेगी, आपको
Hmm.
पानी आ रहा होगा, एंड you'll know that आपको आंख आ गई. अभी सब लोग बच्चों बच्चों को भी मालूम है, right?
इसके causes क्या है?
So conjunctivitis can be viral or bacterial. लेकिन बैक्टीरियल रहेगा तो चिकट पानी आएगा, you'll have a discharge.
Yes.
हाँ, तो आपकी आंख सुबह में चिपकी हुई रहेगी, और उसको गर्म पानी से साफ करने से वो खुलेगी. लेकिन वायरल कंजंक्टिवाइटिस के अंदर आंख चिपकी हुई नहीं रहेगी, कंटिन्यूसली वाटर होती रहेगी, म्यूकस नहीं रहेगा.
As you said about water, what do you say about dry eyes?
Dry eyes is a very common condition right now. Dry eyes, I would divide dry eyes for people into conditions like, first is long screen time. So this would fall under computer vision syndrome. Now, in computer vision syndrome, what happens is that your blink rate decreases
Yes.
while you're seeing. जब आप देख रहे हैं तो जितने बार आप आंख झपकते हैं वो कम हो जाता है. And what happens after that is, तो आप जितने बार आंख झपकते हैं वो कम हो जाता है. और जनरली जो कंडीशंस के अंदर आप बैठते हैं,
Hmm.
वो एक एयर कंडीशन रूम रहेगा जहाँ पे आप व्यू कर रहे हैं, या तो पंखा चालू रहेगा और आप लेटे हैं और आप टीवी देख रहे हैं. तो इसकी वजह से टीयर फिल्म इवेपोरेट हो जाती है, और इवेपोरेट होने की वजह से आपको ड्राई आइज आ जाता है, आपको हेडेक होता है. तो फॉर एवरी 40 मिनट्स दैट यू यूज़ द स्क्रीन टाइम, हर 40 मिनट पे जो आप स्क्रीन टाइम देखते हैं, आप बाहर कोई दूर झाड़ को देख लीजिए, और फिर 5 मिनट दूर देखने के बाद आप वापस आ जाइए, एंड यूल बी मच बेटर, राइट.
सो व्हाट यू से, आपने जैसा स्क्रीन टाइम बोला, अभी देखो कि आफ्टर हैविंग कोविड उसके बाद से इतना स्क्रीन टाइम बढ़ गया है, क्योंकि मैनी पीपल आर शिफ्टेड टू वर्क फ्रॉम होम. तो 8 to 10 hours कंटिन्यूसली दे आर यूजिंग लैपटॉप, कंप्यूटर, डिजिटल मीडिया एज गेटिंग ग्रॉस. व्हाट यू से अबाउट दैट?
See, if they're doing it for personal work purposes, yeah, then they have no way out. And I don't think so. Having a long screen time is going to make you blind in any manner. You can develop dry eyes, you can have a headache, all of these conditions I can accept,
Migraine.
but yeah, you can have a migraine too, yes. But I wouldn't say that you could go blind, because if that was true, then every person who's above 60 has been watching the TV for so many years, they're doing perfectly fine. So it's not the amount of screen time that matters, but it is how you take breaks from the screen time and get back to your reality, and then get back onto the screen time, to get back on the screen. So this is one of the things. The second thing is that from the nervous system, those people who are just whiling away the time over Instagram, they're just moving up and down over Reels and IGTV and all of that jazz. So it's causing a slight amount of dopamine release.
Yes.
And this release of dopamine is preventing them from going off to sleep, because generally the lights are shut, and the phone is there, and the blue rays are
Midnight screen time.
yeah, midnight screen time. And that's basically the problem, where you just want to keep going on and on and on and on and on, and you're not able to get sleep. So 1 hour prior to sleeping, you should just do away with your phone or any form of a digital screen. Maybe read a book.
इवन सम ऑफ देम सेज कि यार मैं तो ब्लू ब्लॉक ग्लासेस यूज करता हूँ, तो मुझे कैसे क्या इफेक्ट करेगा? व्हाट
No,
अबाउट दैट?
I don't think so. Those blue block glasses have anything to do. It's just a commercial gimmick, honestly. Like, no,
ओके.
nothing. The filtering glasses are absolutely a eye wash.
व्हाट अबाउट जैसे कि अगर इफ अ पर्सन इज हैविंग रेड आइज, तो नेचुरली बाय सेल्फ केयर इट कैन बी क्योरेबल?
If he doesn't do anything, and the virus is not very potent, and his immunity is decent, in 5-6 days he will recover. But if he wants to have a pain-free recovery and if he wants to get away with the symptoms soon, yeah. So if he starts on treatment, the chances of him not prolonging it for 7 days and being fine in like 3 or 4 days is pretty much high.
Like any eye drop you consult for them? Suggest?
No, I cannot tell you what medication you'll have to take up on a podcast, because then it would just become common knowledge for anything that's red in the eye, which is not even a red eye. It could
Yes.
be glaucoma, it could be uveitis, it could be a
Condition
foreign body,
matters.
any condition which is not self-diagnosed. So I would just say that go to the closest ophthalmologist and get yourself checked.
यस.
Yeah.
एंड व्हाट अबाउट बाइक राइडर्स? बाइक जैसे हम लोग बाइक राइडिंग करते हैं, राइट? ये तो कॉमन क्वेश्चन है कि हम बाइक राइडिंग करते तो वहाँ से डस्ट बहुत लगता है आंखों पे, तो वो भी कहीं ना कहीं हमारे आँख को डैमेज करता है, आई आई हेल्थ वीक करता है.
बाइक राइडर्स के अंदर एलर्जिक कंजंक्टिवाइटिस सबसे हाईएस्ट है,
हम्म.
क्योंकि वो लोग चश्मा तो पहनेंगे,
हम्म.
हेलमेट भी पहनेंगे, लेकिन उसके ऊपर का वाइजर जो ढक्कन रहता है आगे का
वाइजर
वो नहीं
वो
लगाएंगे,
नहीं लगाते.
क्योंकि
यस,
उनको
ट्रू.
बहुत ज़्यादा गर्मी होती है और वो
हाँ.
फॉग हो जाता है
हम्म.
ह्यूमिडिटी की वजह से। तो जितने भी बाइक राइडर्स हैं, if they can put on a visor to their helmet and wear protective clear glasses inside, yeah, and wear a pretty good nose and mouth covering, if you're going a long distance, it can definitely save you a lot of worries from the health, from the point of developing an allergic quotient to your overall condition.
एज यू नो, प्रिवेंशन इज बेटर देन क्योर, राइट? तो आजकल के पेरेंट्स लोगों को आप कुछ बोलना चाहते हो फॉर देयर चिल्ड्रन?
I think that every child, जो भी जितने भी बच्चे पैदा होते हैं,
हम्म.
तो इंटरनेशनल प्रोटोकॉल के हिसाब से पैदा होने पे 3 महीने पे, 8 महीने पे, 12 महीने पे, जब जब उसके वैक्सीनेशन डेज रहते हैं, उसके साथ एक ऑप्थेल्मोलॉजी फॉलोअप के अंदर रेटिनोस्कोपी की जाती है। एक सर्टेन प्रोसीजर रहता है जिसके अंदर हमें बच्चे की आंख का नंबर पता चल जाता है। तो अगर वो जन्मी तरीके से मायोप रहेगा, या तो उसको पैदा होने के टाइम पे भी एक नंबर रहेगा, तो हम उसके ऊपर एक बहुत ही कड़ी निगरानी रख सकते हैं, और उसका नंबर किस तरीके से तब्दील हो रहा है उसको देखते हुए, या चेंज हो रहा है नंबर, नहीं हो रहा है। सो व्हेन ही इज ग्रोइंग अप, एम्ब्लायोपिया जो कंडीशन है जहाँ पे आप एक नंबर करेक्ट नहीं करते हैं जब बच्चा छोटा रहता है, तो उसके वो न्यूरॉन्स डेवलप ही नहीं होते हैं, उसका वो माइंड आई कनेक्शन डेवलप ही नहीं होता है। तो इसलिए बच्चा जब छोटा रहता है तब एक ऑफ्थेल्मोलॉजिस्ट के पास जाना चाहिए उसने, एट अ स्कूल लेवल। फिर स्कूल के अंदर आपने देखना चाहिए कि बच्चा आपका बीच में बैठ रहा है, आगे बैठ रहा है, पीछे बैठ रहा है, उसका परफॉर्मेंस कैसा है पढ़ाई में। अगर वो बात नहीं सुन रहा है टीचर की, अगर वो परफॉर्म नहीं कर पा रहा है स्कूल में, तो 100% एक ऑफ्थेल्मोलॉजिस्ट को दिखाना चाहिए, क्योंकि अगर उसको दिख ही नहीं रहा है बोर्ड पे कुछ, तो क्या ही परफॉर्म कर पाएगा।
यस, राइट.
If he cannot see what's written on the board, and if he cannot interpret what's written on the board, what is he going to write in his book, and what is he going to, so what he starts doing, he starts seeing the child sitting next to him, and he starts copying exactly what the child is doing, and that's
यस,
how
राइट.
the worksheets are being filled. So he cannot see, he can understand but he can't see, but he can see the kid next to him, and that's exactly how he is getting through with his life. So if you just give him glasses, he won't be dependent on the kid sitting next to him, and he can see it for himself.
एज यू सेड अबाउट ग्लासेस, आपने देखा रहेगा जो हमारे पहले जनरेशन थे, उनको ग्लासेस बहुत एल्डर, इतना यंगर एज पे नहीं लगता था. जब आज देखोगे कि आज बहुत ही वेरी यंग एज में हमको ग्लासेस ग्लासेस पहनना पड़ रहा है.
पहले उतना अवेयरनेस नहीं था, तो पहले भी उतने ही ग्लासेस थे, उतने ही बच्चों को नंबर था। आज भी उतने ही ग्लासेस है, उतने बच्चों को नंबर है। लेकिन पहले
लैक ऑफ नॉलेज.
लैक ऑफ नॉलेज था, इंस्टाग्राम नहीं था, आपको कहीं पे जाके बताना नहीं था, आपको लगता था कि भाई सबकी रोशनी इतनी ही है। जनरली यू आस्क देम दैट व्हाई, क्यों क्यों नहीं आते डॉक्टर के पास, दे से कि हम लोग को लगा इतनी रोशनी है सब लोगों के पास, हमें कैसे पता चलेगा सब लोगों को हमारी से अच्छी रोशनी है।
बराबर.
इफ ही हैज नॉट सीन the best vision that he is capable of having, how would he even miss it? What you don't have, you don't miss.
ओके. व्हाट अबाउट योर एनी फनी पार्ट? हैव यू एक्सपीरियंस एनी?
So basically, I do volume cataract surgeries,
यस.
and when you do a volume practice, It's generally with the foundation and with the charity work that we do, we get patients from lower socioeconomic status, and patient ignorance is quite high, and they have a lot of myths. So you don't only have to operate him, but you have to educate him. And educating a patient who's already got preconceived notions, maybe the neighbor told him, maybe he heard from somebody in his family, some friends spoke about it, these notions can't be broken. So you need to break them by example.
Yes.
That कि अभी जैसे पेशेंट्स हैं, अभी एक पेशेंट का मैंने ऑपरेशन किया, 15 दिन हो गए, मेरे पास फॉलोअप के लिए आया, 15 दिन बाद आया और मुझे बोल रहा है कि सर मैं ट्यूबलाइट चालू कर सकता हूँ क्या रूम में? मैंने कहा क्यों, ट्यूबलाइट चालू करने में क्या है? बोले नहीं, ऑपरेशन हुआ है ना, इसलिए मैं 15 दिन से अंधेरे में ही रह रहा हूँ, मैं कहीं जा नहीं रहा हूँ, मैं
लाइट
कुछ
बिल
नहीं
बचा।
कर रहा हूँ. So these are preconceived notions. I never told him to do all of that. I told him to resume work after
Yes.
2 weeks. But now he's coming in, he's telling me that, oh, he's not been sitting in an ambient light environment. He's in darkness. So, this is one of the things. Second thing is that you have to tell them to the specific.
Yes.
किसी को भी, अभी मैंने ये सीखा है जिंदगी में, किसी को भी कोई चीज बोलो तो एकदम स्पेसिफिक तरीके से बोलो.
स्पेसिफिक
प्रोटोकॉल बेस्ड
प्रोटोकॉल
स्पेसिफिक
के
तरीके
साथ
से बोलो, कोई भी चीज बोलना है, और रिटन में भी दे दो.
प्रोवाइड ए कंप्लीट नॉलेज।
प्रोवाइड कंप्लीट नॉलेज.
अच्छा, लास्ट टाइम हमारी बात हुई थी तभी आपने एक पेशेंट के बारे में भी बताया था, आई ड्रॉप से रिलेटेड।
जी. तो एक पेशेंट था हमारा, और कैटरेक्ट सर्जरी कराए, हमने
हाँ।
उनको ड्रॉप्स दिए. वो अगले दिन फॉलोअप के लिए आए, और ड्रॉप्स खाली थे, और बोला
हाँ।
कि ड्रॉप्स ख़त्म हो गए. तो एक ड्रॉप जनरली 5 ml का रहता है, 20 दिन चलता है. तो एक दिन में ख़त्म कर देना, मुझे लगा हाथ से गिर गए, और तीनों के तीनों खाली थे. तो मैंने उसको एक नया पैकेट दिया
नया पैकेट में।
ड्रॉप्स का, और बोला कि आई वॉजेंट अवेयर कि कब उसने डाला होगा लास्ट अपनी माँ को ड्रॉप्स. तो बंदा बाहर गया, बैठा, और मैंने उसको बोल दिया डाल दीजिएगा. और मैं सीसीटीवी कैमरा में कुछ काम कर रहा था, सीसीटीवी कैमरा पे मेरी नज़र गई, तो ये बंदा माँ जी का मुंह खोल के मुंह में ड्रॉप्स डाल रहा है, चार चार पांच पांच बार. और
सॉरी।
और इसलिए
भाई साहब, लैक ऑफ नॉलेज।
not lack of knowledge. I think from there I learned
दे
that,
आर नॉट अवेयर अबाउट दैट।
yeah,
कि
that
हाँ।
that we that as doctors we take it for granted कि भाई आंख में ही डालेगा.
हाँ।
लेकिन वो ऐसी जगह से आया जो उसको मालूम ही नहीं आंख में ड्रॉप्स डालना है. उसको लगता है कि हर ड्रॉप मुंह में ही
मुंह में डालना,
और जब से
हाँ।
पोलियो का
पोलियो डोज।
दो दो बूंद जिंदगी के
दो
हो गया, तो
जिंदगी,
उस
पूरा
तरीके
बॉटल
से.
जिंदगी।
तो it's a sad state of affairs, but you know.
And as you say, what is age group? Any prevention for us as particular age group?
First cataract would take place at quite older age groups, maybe above 60.
Hmm.
लेकिन अभी आप देखेंगे कि 38 years old, 40 year old को कैटरैक्ट हो रहा है. And when we look into it, it's basically the UV light that they're exposed to. That's a very important factor. And second factor is processed high sugared foods,
I should.
because they keep changing the glycemic index of the blood and of the lens and of the aqueous, which is a fluid in front of the lens, and that causes clouding of the lens. So, and that leads to an early age cataract.
For
So I
eye.
think lifestyle changes of, including exercising, eating right, not eating processed foods, eating wholesome foods, and eating at particular times, sleeping and waking up at a particular time, is not only for the eyes, but your overall life could change with just doing as little as that.
Any particular nutrition for eye health?
Carrots you can eat, but nothing so specific. If you're just gonna keep them clean, keep your hands away from your eyes, and take care of your screen time, you could lead a pretty good life.
If someone is a retinol deficient, then
Oh, then you'll have to do blood tests. You'll have to see what is the deficiency, what is the quantification of deficiency, and then supplement it. But for that, again, you'll start having dryness of the eyes, night blindness. You'll start with the vitamin A deficiency. So those characteristics, and these are generally picked up at a younger age group. Even in adults, it's common, but it will be very specific that I can't see at night. or my eyes feel very dry and I can't see at night. But they generally complain of not being able to see at night, or the dark adaptation phase will increase कि लाइट चली गई तो जैसे आपको थोड़ी देर में दिखने लगता है थोड़ी
Hmm.
बहुत चीजें, आप टेबल देख पाते हो, इनको कुछ भी नहीं दिखता है.
Okay.
So that's another thing.
एंड सर आपने भी शायद से सुना रहेगा, इवन मैंने भी कई जगह सुना है, कुछ कुछ लोग बोलते हैं कि पावर लिफ्टिंग करने से, वेट लिफ्टिंग करने से आई हेल्थ में इशू होता है।
तो रेटिना रिलेटेड इश्यूज पावर लिफ्टर्स में आते हैं, मजदूरों में आते हैं जो भी बहुत ज़्यादा एफर्ट बेस्ड काम कर रहा है, हाई इंटेंसिटी का. जैसे पावर लिफ्टिंग के अंदर there's one rep max, लोग को एक रेप मारना है of the
यस, वन रप
heaviest weight,
मैक्स या
yeah, for the max weight that they can lift.
टू
So
हिट
they
द
wear a
ऑडियंस।
belt, and they hold their breath,
यस।
and in doing that, and they have sniffing salts.
हायर
Yeah.
वेल्सिल्वा, हायर
So,
वेल्सिल्वा।
yeah, Valsalva's retinopathy is very common in them where they are lifting against this. So that causes, but I've not seen too many. I've not seen too many of these, except for one laborer who had it. But I think powerlifting overall, more than the eye, on the joints, it's quite a painful condition because the joints, year after year, year after year, you're lifting that kind of weight, and if you're not taking enough rest and you're trying to activate your CNS again and again and again and again, I think from that perspective, yes, the joints definitely take a toll, because I used to lift really heavy weights earlier, and now I lift moderately heavy weights. So when I was lifting very heavy weights, my back, my knees, my elbows, would not be too comfortable. And anybody says it's too comfortable, now they're lying, or they can lift much more.
यस। एज यू आर अ सर्जन, सो while doing operation, what comes into your mind?
While you're doing the surgery, what comes into my mind? Absolutely nothing. I don't have any distracting thoughts, nothing. So it is me, my mind, my hands, and the patient's eye. So at that point of time, any sound could be irritating. People coming inside and going outside the OT could be irritating. So it's like meditation. You're just meditating while you're operating. So you have nothing going through your head. All you care about is execution with perfection, because the eye doesn't give a second chance. There's only one shot you got where you need to do the best job every time.
Okay. No any distractions?
No, no phones, nothing. Nothing's allowed inside.
Yes.
Yeah. Even the number of people, I have a protocol in which the number of people inside the OT just remain constant. People don't keep coming in, out, because, it can be too distracting. The door opens, the door closes. Though you're trying to concentrate, these minor things can, just irritate you.
Yes.
It irritates me for sure. I don't know. Other doctors might have a different take on it, but I like pin drop silence in my OT.
एंड वन पर्सन आस्क्ड मी कि सर मेरी दादी जी है, मेरी दादी जी वाज फेसिंग कैटरैक्ट इशू एंड उनका एक साइड का विजन ऑलमोस्ट पूरा नील हो गया था एंड राइट साइड का विजन समथिंग 16% रह गया था। देन शी गॉन फॉर अ कंसल्टेशन टू द डॉक्टर एंड डॉक्टर ने बोला कि नहीं माँ जी, आपका यहाँ पे ट्रीटमेंट नहीं होगा, आपको 2 लाख रुपए भरना पड़ेगा और ऊपर से अब्रॉड में आपका ट्रीटमेंट होगा। तो क्या आप कहते हैं कि आज भी अपने इंडिया में वैसे टेक्नोलॉजी है नहीं?
इंडिया के अंदर तो हर टेक्नोलॉजी है.
यस,
We are
राइट।
we are not
तो वो
technologically
डॉक्टर ने
backward
ऐसा क्यों
at
बोला?
all from the medical point of view. We've got the highest amount of foreign medical tourism.
हम्म।
बाहर बाहर की बाहर से बहुत सारे लोग आते हैं
यस,
इंडिया में
ट्रू।
अपना ट्रीटमेंट कराने, स्पेशली फ्रॉम द गल्फ, from South Africa, a lot of places. So I wouldn't say that we are technologically not advanced. I could just say that sometimes our patients wait so long before taking an opinion that if they have another disease, like if they have glaucoma and cataract,
हम्म।
by the time they come to us with a high pressure in the eye, glaucoma basically means high pressure of the eye. So the eye can have an intraocular pressure anywhere between 11 to 21. But these people have a constant pressure, maybe their pressure is 26, 27, and year on year they don't get a checkup. And then they develop a cataract, so they lose all their vision. So even after doing the cataract surgery, they could see very little because they have another disease that is alongside working with cataract in decreasing their vision. So my advice would be that go see an eye surgeon at least twice a year, if not once. You know, twice a year you should see an eye surgeon, or maybe at least once a year. Once a year should be protocol.
Okay. By the way, sorry to say you are having a very nice physique.
Oh, thank you
So,
so much for that.
so what's your personal healthcare routine?
My personal healthcare routine is I don't eat any form of sugar,
Oh, nice.
zero sugar. I work out every day for 1.5 hours. I do moderate to intensive weightlifting, and followed by that, I do some amount of cardiovascular training and stretching. Um,
फॉर दोज जो कहते हैं मेरे पास टाइम नहीं है, देखो डॉक्टर होके सर्जन होके भी डेली वर्कआउट कर रहे हैं एंड ही इज फॉलोइंग हेल्दी लाइफस्टाइल
but it's
दैट इज
it's I can only do this because I follow a healthy lifestyle. If I would be fat, obese, you know, my interest level or my performance, basic outlook towards life would be very, very poor. And what I do is that I only eat once a day. I only eat at night after my training, and then I go to sleep. That's pretty bad.
इंटरमीडिएट.
Yeah, I do intermittent fasting. I generally eat once in every 24 hours, but I eat pretty late. I eat by like 12:30, and I try to sleep by like 1:30 because I have to wake up at 7, 8. Yeah, so I get 6 hours of sleep, and I like to get into that zone after working out where I'm so tired after the whole day, and then I've worked out that I just want to eat and I want to sleep. So yeah, but I keep my sleeping time and wake up time this constant throughout the year. I don't change that,
या
and I rarely cheat on my meals. I wouldn't go out and eat a pizza or eat a
पिज़्ज़ा,
burger.
बर्गर.
No, I wouldn't, because the amount of effort I put in to get into that state, just a burger or a pizza won't take me out. But the problem is that if I eat today, I might just say that, okay, I'll eat tomorrow. And then one day becomes a week, week becomes a month, month becomes 6 months. And then you
चल
see
आज
that
नहीं,
you
कल कल कर
कल
लेते हैं,
कल
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 नहीं परसों कर
तो वो
लेते
कल
हैं.
कभी नहीं
वो
आता है.
कल कभी नहीं आता है.
तो
ट्रू.
आज में ऐसा कुछ काम मत करो कि कल में आपको उसको दुरुस्त करना
नेगेटिव
पड़ेगा.
इफेक्ट करे.
Yeah.
Yes. What about your future plans?
So I plan to have a large number of eye centers across the city, then across the country, which works on the same motto
Hmm.
of providing vision. Instead
Okay.
of having one consolidated center where
हाँ.
there'd be an info that is an in-reach technique, I believe more in an outreach technique,
Right.
because some person can afford to travel to you, but there could be a lot of people who wouldn't take that effort, or the
Long distance.
yeah, distance is a very important factor because follow up becomes difficult, everything becomes difficult. So I like to have many more centers where I'm closer to the patients in terms of approachability.
And what about any firm you are working with? Any foundation?
So basically, foundation. So we have a charitable wing,
Hmm.
and we've got donors. So when there's somebody who cannot afford anything, so not only we do the surgery for the patient, we even give him ration, because um, if we don't give ration to this patient in terms of rice, dal, and other commodities, though we've done a cataract surgery, he will not be in the best of health to recover well because his food intake is compromised.
Yes.
So not only we take care of the eye of the person, we even see that he's being well fed. So yeah,
Thank you, sir, for having a great, fruitful conversation with us. Would you like to say
you're most
something?
welcome. I think I'm pretty much impressed with Fit the Fashion, where you've got Manish, one of my close friends, on your podcast. And
Yes.
I think that the future for Fit the Fashion should be that it should um, look into fashion as well as
Fashion as
fitness
well.
for the youth. And I think guys follow him.
Sure, sure, sure. Thank you,
And
sir.
for
Thank you
future
so much.
collaborations, I'm always there. We should do definitely work out together
Sure.
and
Why
get
not?
Manish on it.
Yes,
Yeah.
of course.